Let's go over the heart failure with the reduced ejection fraction and the heart failure with the preserved ejection fraction. So before we go into, I want to explain what is ejection fraction. Ejection fraction is basically how much effort the ventricles take to pump the blood out, right? So this is our normal heart, and you see the ventricle relax and expand to fill with the blood, and that is filling is happening during diastole, right? They are filling with the blood normally. Now then your ventricles during pumping is happening during systole. They contract and pump out the blood, right? And during diastole is filling, systole is pumping, right? Now let's come over this side where the systolic heart failure with the reduced ejection fraction. What happened in the systolic heart failure is these ventricles actually fill with the blood. The muscles around the ventricles become thin, and they become weak. And then the weak muscles, when they stretch, now the ventricles are filling normally, they fill, but they become so enlarged that they lose their ability to pump the blood effectively, and they actually, what they do is they pump out the less blood than normal. Okay. On the other hand side, in the diastolic heart failure, these muscles become thick. Now as they become thick, what's happening here is the blood is also less. You see that they become thick, but there is also a less blood than the normal. Now these thickened ventricles, they don't lose their ability to contract. They contract normally, but have a less blood to pump out. So the presence of the preserved ejection fraction in the diastolic heart failure is due to the adaptation of the increased workload caused by the stiff, what they call the stiff left ventricle. Now the left ventricle become thick, but they also compensate. They have a less blood to pump, which compensate and for the reduced ability to relax, which actually reduce the ability to relax. This mechanism lead to the increased ejection fraction. That's why in the diastolic heart failure you see the preserved ejection fraction, and in the systolic heart failure this is kind of a difference between the reduced ejection fraction and the increased ejection fraction.